why have these programs been so successful? As it has been said here, the involvement of multiple sectors is extremely important, and these two programs would not have worked if the public sector, and by public sector it's not just health, but several education, transportation, public safety, physical education, urban planning, and many more that aren't in this list. The universities that provide some sort of objectivity by assessing these programs, the private sector, NGOs, partnerships, and I think very importantly, we are talking a lot about the things that work in Latin America or other places, many lower to middle income countries, but a lot of these, and especially the evaluation of a lot of these, the rigorous evaluation, has been possible because of very strong and well-thought partnerships with US-based organizations. So the US hasn't been completely oblivious to this. They have provided the funding, the training to conduct these assessments. And that has been extremely important. We have all the evidence that we have about the effect of ciclovías and the effect of the Academia de Saúde program because of these international partnerships with the CDC, with universities, etc. Obviously, political will, having a good champion to advocate for these programs, usually a good mayor is needed for these citywide programs to work. Cultural adaptations for all settings, even if it's within the same country, to move it from one city to another, it's much more likely to be successful if you incorporate local aspects to the program. And as I've been saying, the whole aspect about social equity and social interaction has been key for this. Frequency. It's not enough to say we're bringing it to the US, in Atlanta it happens twice a year, or maybe now 4 times a year. That's a cool thing that happens, and it's fun, and that's it. But it's not going to have an impact in public health if it's not frequent. So that's taking the next step. Support from the community. And luck for all of these things to align. So how do we generate public demand for environments and policies for active living? And this is just what I think. This is not like a magic solution to things. But I think that we need to highlight the right of citizens to have access to public spaces and their value beyond health. What are they bringing to their lives? To be honest, most people, even in countries where we do think of health as a public right, or as a human right, I'm sorry. Most people don't go out to enjoy the ciclovia because of health. Most people just do it to socialize and to have fun and to enjoy their city. So we really need to start marketing these values. Safety is a really big one, especially for underserved populations. You can now have safe access to your street without having cars all over the place or the danger of crime. Because usually these programs, if they're well implemented, you have a lot of coordination from the police. Okay. And how do researchers come into play? I believe that more so than developing programs or interventions and saying now we have to test them, it's hard to convince a whole city to test your intervention scientifically, to run a randomized controlled trial using cities as your. So it's more identify these spontaneous strategies that are occurring all over the place, small or big, whether it's a neighborhood strategy, a citywide strategy, try to identify them. Many of those aren't marketed or aren't as obviously related to health. But if you in your field, physical activity, nutrition, or whatever, think that it may have an impact in what you're interested in, go and assess it. And try not to assess just what you think it has an impact in, but also the things that people are the motivators. Is it increasing quality of life? Is it increasing social equity? And all of these other things that we have. I think cost effectiveness, as it's been talked about here a lot, is extremely important to assess. Especially if we want to create a culture where people here start to understand health as a common good, or on the long term, hopefully as a human right. We need to show them how health for all benefits me, because that's how people think. And that's what's going to motivate them to start supporting these strategies. And as researchers, we need to focus more on disseminating these findings from these evaluations, both health evaluations and all of these other outcomes, in non-research outlets. I know that we care a lot about our scientific publications and our impact factors and whatnot, but if we want to see change, we need to make sure to disseminate our findings to a broader audience.